please?
Yes.
Okay, good.
Good.
She's
Okay,
recording now. Okay, yeah, because he asked me to send a request as well.
Okay, so
okay,
start.
Good morning, everybody. Good afternoon.
morning.
If you're wherever you're calling from, I'll just say good morning, good afternoon, good evening, good night. We never know where people
That's
join from. So welcome to our presentation today. We're glad to have you in our midst. Our presentation is going to be on menopause and erectile dysfunction. And my name is Angela Ofuebu. So I'm going to be kicking off the presentation. So this is a collaboration between our Community Health Awareness Program, Center for Family Health Initiative, and the Imo State Women Organization. All these are nonprofit organizations working to better our community. To better our community. Please, I'll ask that everybody be muted while the presentation is going on. During the Q&A, you can open your mic, but while the presentation is going on, please stay muted for the benefits so that others can benefit from this without the extra noise. Thank you very much. So as I was saying, these are nonprofit organizations that are working hard to better our communities, both here in Nigeria and the United States. Okay. So moving forward, today's webinar is brought to you by these organizations. It's a collaboration. So you can see how much work we're doing in our community, trying to get everybody involved. The next slide. The presenters, some of us are here today, some of us are not able to be here, but those of us that are here will do justice to this topic. So what we will cover today, it will be overview of menopause and erectile dysfunction, popularly known as ED. It will be done, that will be presented by me. We'll have a clinical signs and symptoms of menopause and erectile dysfunction. Dr. Esther Okavo will be doing justice to that subsection. And a discussion on diagnosis and management of menopause, which need to be presented by Dr. Peace, and also diagnosis and management of erectile dysfunction, which will be presented by Dr. Obinna. Please, can you mute this person, the presenters, please? Thank you. So let's get going. And this is me, just a little bit about me. Thank you. So menopause overview. Menopause is an erectile menopause and erectile dysfunction.
Angela, you're muted. Angela, you're muted. We can't hear you. You're muted.
I'm so sorry, Angela, mute yourself. I'm so sorry. Sorry about that. Oh my goodness. I am so sorry.
It's okay. No, it's okay. You muted everybody. So welcome back, Angela.
What was the last slide you heard?
Overview.
From the beginning.
Okay. Let me get into the overview because yeah, that's the important stuff.
Okay.
Menopause and erectile dysfunction are conditions that impact one's reproductive, mental, and physical health. So it covers the whole person. That's why it's a very important topic. And when we hear menopause, it's a condition that affects people that are genetically assigned female gender at birth, and also erectile dysfunction in males that are assigned that gender at birth. The factors that may impact the onset of these conditions include aging, genetics, which we cannot control, your race and ethnicity, and also some other external factors. So what is menopause? Menopause is when a person have gone through 12 consecutive months without a menstrual period. So you have to have gone without. If you have menstrual period in between, it's not considered menopause yet. So prior to being fully menopausal, there's a stage, a period that we call menopausal transition or perimenopause. Most of us are familiar with the word perimenopause. This precedes menopause, the period before the menopause actually starts, when a female body experiences changes in the production of the female reproductive hormones, for example, estrogen. There are other female reproductive hormones, progesterone and testosterone as well. So what is perimenopause? Let's go a little bit into that one. So this period is usually between 45 and 55 years old. Those who have that 10-year span that is commonly what commonly occurs in the females. Is also prior to that 12-month mark before you have a cease in menstrual flow. It lasts about 7 years, but can be as long as 14. The severity and duration of symptoms is affected by your lifestyle, smoking, age of onset, race, ethnicity, and other, behaviors or lifestyles that we have adopted as humans may end up impacting when this happens, the severity and all that stuff. So menopause may be caused by a variety of things. Let's look at the natural decline of hormones. We already heard that there will be changes in those 3 hormones that the female makes as part of their reproductive system. So when the level of these hormones decline, it will affect the ability of the ovaries to produce eggs. And if your ovaries are not producing eggs, the eggs are not going to descend into your uterus and flow out as a menstrual flow if pregnancy does not occur. So there's loss of this ability. And there's also a decline in estrogen level in the blood. It looks like estrogen is the primary hormone involved. Menopause may be also caused by surgical removal of the ovaries. This is like an instant kind of menopause. When the ovaries are gone, thinking about the relationship the ovaries have with making eggs and then menstruation. If the ovaries are no longer there, periods are no longer going to occur, and then one will be thrown into an instant menopause. Certain procedures or treatment may also trigger menopause, like chemotherapy. Chemotherapy, a cancer treatment that is used to get rid of malignant cells, that overwhelm our body with different kinds of cancers. So when these chemicals are infused into one's body, they go for all the cells. And of course, the over, is part of the cells in the body. And then it will be, it will kill everything, not minding what is what. Some people are able to, overcome this after they heal. Their body still may be able to continue to produce eggs, and they still may be able to have children. But chemotherapy is a very significant factor that triggers menopause. Radiations. With radiation therapy, also cancer treatment, the intensity or the factor that is very important with radiation is what part of the body was radiated. You can see that when you go to X-ray, how the technicians, they protect some parts of your body because they just want to focus on one. But the radiations that we need to worry about when it comes to menopause and impacting ovaries is the ones that occur in the pelvis area, in your belly area, lower spine, and also if it's a whole body kind of radiation. There's also primary ovarian insufficiency, and this is what we commonly call the premature menopause kind of. Now, you've been thrown out of that age range, 45 to 55, and now you're experiencing early onset menopause. The ovaries are not making the usual levels of hormones, and this can be caused by genetic changes or autoimmune disease, and it can also be caused by other factors. But this is very common. It's not premature menopause, except if it occurs before the age of 40. About 1% of our female population do experience this kind of menopause. So prevalence of menopause. There are, varieties of research, that are out there to see how menopause impacts, communities or ethnicities. I found this research done in Osogbo, southwest part of Nigeria, where we, commonly known as the Yoruba tribe. This research indicated that 51.6% of women between the ages of 55 and 64 were experiencing menopause. That's like half of the women in that age bracket. And then the average age of menopause was 58.7 years old. And the most frequently reported symptom is internal heat. I don't know if some of us here remember growing up when our moms and grandmas, I have internal heat, I have a migraine okrimbawishi in Igbo, but this is migraine headache. So internal heat is a very, very, very common symptom. That's why women run into the refrigerator or open the refrigerator to stick their head into it. But anyway, so 52% of women do experience this internal heat symptom.
Oh, that's so funny.
In the United States, more than 1 million females experience menopause each year. That's a lot. And the average age of onset is 51. So it looks like we're doing better in Nigeria. Ours is 58.7 approximately, and in the US, like 51. I'm not sure why. Maybe, onset of modern stuff and processed food and God knows what. African Americans, females, experience menopause onset earlier than other women. Just affects us just like other health issues affect us, maybe due to marginalization or not having good access to stuff that keep us more healthy. And also have longer period of menopause transition, have worse vasomotor symptom, which this internal heat is a vasomotor symptom. And that's even the worst. We for African Americans, our symptoms last for 10 years compared to, others that are more fortunate, 6 years. Okay. So I'm going to swing into the next topic, which is erectile dysfunction, commonly known as ED. So what is erectile dysfunction? Inability of a male to get or maintain an erection of the penis long enough to have sexual intercourse. When do we get concerned? We're going to hear more about the signs and symptoms, but generally speaking, we should get concerned, or the male should get concerned when it becomes an ongoing issue, not a one-time incident or very common, goes on for days or weeks or months. And it affects the person's self-confidence. It results in relationship problems with your significant other or spouse. And if it's a sign of underlying health conditions, we'll see some health conditions that kind of affect or impact erectile dysfunction. Okay. So causes of ED, there are physical and there are psychological. Just like everything in life, there's always a mind and body connection. And I truly believe that. So this condition also, have that impact on it. So the physical stuff includes heart disease. Of course, we know with heart disease, circulation can be impacted, your stamina can be impacted, oxygen level can be impacted in your system. All this may end up affecting the way blood flows to your penile area. High cholesterol level, which clogs our arteries, high blood pressure, diabetes, obesity is a major factor. And Parkinson's disease and all the other stuff. We also see that treatments for prostate cancer or enlarged prostate, of course, if you're prescribed a medication for these conditions, that may end up leading to you having erectile dysfunction. It may not always be the case, but it's a likely factor that may cause it. Or if you have surgery to the pelvic area or injury, which probably disrupts either nerve or circulation, that may also lead to erectile dysfunction. Of course, the big hormone, which men plays a significant role in men's life, low testosterone, also contributes to erectile dysfunction. Other causes include, which I have explained already, kind of, the circulation problem, the nerve dysfunction problem, which can be triggered by anything, including trauma or pelvic surgery or radiation or spinal problem. Hormonal dysfunction, which I mentioned a little bit, the testosterone, and also the thyroid. The thyroid is like an engine for metabolism. A lot of times when people have thyroid problems and it's not corrected, it does affect a lot of stuff. So, that's one of the hormones that I checked, periodically to make sure that it's going okay, because it can be a contributing factor to a whole lot of stuff, including weight gain, diabetes, metabolic syndrome, a lot of stuff. There's also a cause, the psychological factor called psychogenic erectile dysfunction. So, of course, when your thought, the way you think affects the way you feel, that affects the way, people see you or things that happen in your body. That's still that mind and body connection. That's a psychological impact that can happen, that can impact your ability to, maintain an erection. There are also medications, classes of medications that we need to be aware of. I will take a screenshot of this if I'm you. A lot of the medications that we take, even over-the-counter stuff, and we are not aware of what the side effects may be, just in case. Somebody's on antihistamine. What are antihistamines? Just simple Benadryl over the counter. The Benadryl may be in even cold remedies, like cold medications that you get over the counter. So something to be aware of. People on antidepressants. I know a lot of my patients, that's one of the side effects that they complain about, and that would lead to not being adherent to medication, because the antidepressant makes them not feel the way they're supposed to be feeling down there. I hear that complaint a lot. The motion sickness medicine, opioids also does impact, anticonvulsants, even the beta blockers that I use for medications for heart disease. Can you believe that ranitidine, and a medication that is used for ulcers or gastric reflux, also may lead to erectile dysfunction? And let's go to the next slide. The next slide is just telling us varieties of medical conditions that may impact erectile dysfunction. If you're not happy, if you're overwhelmed with anxiety, if you have a lot of stressful things going on and you're not processing the stress well, you're carrying it on your shoulder. Other mental health conditions, relationship conditions, if you have a spouse that is not as supportive and talking you down and not helping you get through it may even worsen the situation. Prevalence of erectile dysfunction. Erectile dysfunction is the most common sex-related condition in males as they age. The risk, of course, increases from 40 years and above if this is occurring as a natural kind of a physical thing, not something that is kind of triggered by other factors. In people that have diabetes, is also the rate is very high, or they have a very high risk. Obesity, depression, and people that are physically inactive. It's good to move around. Endorphins are made, which are those happy-go-lucky hormone. If you're physically active, you secrete those hormones and you're happier and you feel better. Okay. So erectile dysfunction affects approximately 15% of men each year. That's a huge number. And over 150 million men worldwide experience estimated with ED at this time, but the projection in 2025 expected to double, 320. I'm like, wow, this is something we really need to pay attention to. That affects. We really need to have more modalities on how to manage this situation. A study in Nigeria, you can see the first one, there is a 55.1% of men at a primary care clinic in Ibadan had ED. And also in Calabar, 41.5, 43.8 in Oshobo, 46.9, in a Lauren, 58.9. So on the average, we can say about 50% of men end up with ED in their lifetime. So that's the seriousness. Imagine when half of our men are affected by this, it affects their overall health and their overall feeling of well-being. So my colleagues are going to be kind of talking more about self-help and medication that can be used, guided by a doctor or your healthcare provider on how to manage this. That's the end of this section of the presentation, and as you see the references, I'm going to go ahead and welcome our next presenter, Dr. Esther Okafor. She's going to present the manifestations of menopause and ED. Thank you. Welcome, Dr. Esther Okafor.
Good morning, everyone. Can you hear me?
Yes, we can. Thank you. Welcome.
Okay. Thank you. And we appreciate you joining us this morning, spending your time. It's a Saturday, but you're able to make out time to join us this morning. And I thank Dr. Angela for that awesome insight and information on menopause and erectile dysfunction. Once again, thank you for joining us. And I'll be talking about signs and symptoms of menopause and erectile dysfunction.
Dr. Uche, you're muted. You're muted, Dr. Uche.
Okay. Can you hear me now?
Yes,
can you hear me now?
Yes.
Okay. So when you look at the effect of how menopause and erectile, I'm talking about the menopause, how it affects the whole body. It is not just one part of the body, it is the whole body. And different people, based on who you are, based on when you started the menopause or when the symptoms started, how old you are, many people may complain of different signs and symptoms. So depending on who you are, please, hopefully, what we have in front of us, you may be able to determine where you are. Are you experiencing the same signs and symptoms or not? Some people may complain of brain fog. Some people may complain of thinning of the hair. Some people hot flashes, bone loss, dry skin and nails, weight loss, weight gain, sexual dysfunction, dry eyes and mouth, depression and anxiety. Again, bearing in mind that the process that can, like I said before, can affect each woman differently, and it varies in different. It varies in symptoms greatly. And next slide, please. So. Some people, again, these are some of the common signs and symptoms of menopause: irregular menstrual cycle, hot flashes, use of energy changes, fat cell changes, weight gain or weight loss, change in bone and heart health, body shapes and composition, physical function changes. Next slide, please. When people complain of hot flashes, it includes sudden feeling of hot or cold on your face or chest, that some people may even feel dizzy, night sweats, vaginal dryness, pain, itching, or discomfort during sex. frequent urge to urinate, more frequent urinary tract infection, difficulty sleeping, emotional changes. Sometimes some women will complain, what is going on with me? I feel I have mood swings. I feel I get angry easily. Some people even feel depressed. So at what point or what, like I said before, each person's degree of symptoms and signs are different. But you have to know your body. You have to know where you are. And it is the right time when you are not sure what is going on. It's not just you, it's your family members, people that care about you as a person, your children. Some people may point it out. You may not even know what is going on with you. Please, it is the right time to talk to your provider and see what can be done and just report. I'm feeling this way. It has never happened. And sometimes some of us may say, I thought menopause starts later in life. Some people may even start at 35 years of age, 40 years, 50 years. It doesn't matter. Wherever the age is, whenever you notice the symptoms, it is important for you to report to your provider. We continue. Signs and symptoms equally includes dry skin, eye and mouth, breast tenderness, racing heart, joint and muscle aches and pains, changes in sex drive, what we know as libido. And some of these are so important, difficulty concentrating or being more forgetful, especially with the libido. As human beings, sexual coming together or intercourse plays a very important role in relationship. And all of a sudden, person that has been very active, all of a sudden is shying away from having intercourse because of what they're going through. It's not something that you push aside. What is going on? Ask yourself what is going on. And if you are the partner of this particular person, of this particular woman, talk about it. Approach the person. What is going on? It is unlike you. I've noticed so and so that you are shying away from this. Can we talk about it? Even if you don't feel like talking about it, talk to your provider and make sure that things are okay, because there are other ways that what you can do to help get through this hurdle. It is so important because things like this can destroy families. Again, weight gain and weight loss, hair loss or thinning, feeling of loss of self. And there are some people, especially feeling of loss of self, some empty nesters, and the children are no longer there. And then all of a sudden, you are having all these symptoms, and you're wondering what is going on with me. And you feel like you are nobody. You are still the same person. It is just a change of life, and change of life that can be addressed in so many different ways. And you have hope. You have, as long as you ask for help, talk to your provider, and plans can be made so that both you and your family will be in a better situation. The next slide is talking about erectile dysfunction. And our previous provider did a wonderful, showed us a wonderful insight. She went into details about erectile dysfunction. And it is important, something that we don't talk about. Men shy away from there. And our female also may not even talk about it in front of their partners. But it is so important that we spend time talk about it. And what are the symptoms or signs? Trouble getting an erection, not able to get an erection at all, or able to get one sometimes. Some of the symptoms includes not trouble keeping an erection, reduced sex desire, and where does all this lead to? The person that is going through this process feels embarrassed, frustrated, guilty, ashamed, angry. Why me? Or less of a man. It is not a time for somebody going through this to feel less of a man. They are feeling a lot already. They are going through a lot already. They are questioning themselves. Why me? Why me? And if you are the partner, the husband, a significant other, or you notice that a sibling or a friend is going through all these changes, they are frustrated, they are embarrassed about things, they feel less of a man, call them aside. What is going on? This is unlike you. Is what is going on? And sometimes we don't feel so free to talk about it. We shy away from it. But it is not something that you can stay and die in silence. Talk to your provider. And there are ways, there are things that you can do that will help you. And it is a time for family members to be supportive of each other and make it a family thing. Yeah, you may not talk about it, but when you are supporting each other, the person going through it will feel like, okay, now I don't have to die in silence. I don't have to kill myself over anxiety. I don't have to feel less of a man. And all this will help you to build up your self-esteem, be able to continue to do what you do, be able to keep your family together. It is not a time for us to get into divorce. It is not a time to divide our families, but it is a time to help each other. Other symptoms, again, like I said before, reduced sex drive. Yeah, when the person is going through this, you're not having an erection, what mind are you going to have to even think about having sex? What is the point? Because the person is not having any erection. So a lot of stimulation to maintain, you have to help each other out to maintain, to go through this process. Also, sometimes there are things that we may have to equally think about. What are some of the things that has gotten us to this point? We may have to look at, changes and how much lifestyle changes. If you know that you gain a lot of weight, think about it. Exercise to uplift yourself, energize your brain. If you're drinking a lot, cut down on alcohol. These are things that lifestyle changes that are out there that we indulge in that can help us make a significant change in our lives. And it is important, again, like I said, it is not a time to divide family, whether you are going through, you having erectile dysfunction or you're going through menopause. Let us look at it as a time to sit down and talk to each other, unify each other, unify our family, and continue to pass on to other people, other younger people. And thank you again for coming. And I have the references that is passed already. I am all equally going to introduce our next speaker by the name Dr. Peace Ume, who is going to talk about the diagnosis and management of menopause. Thank you again for listening and joining us. Welcome, Dr. Peace Ume.
Thank you. Thank you so much, my friend, colleague, sister. That was wonderful presentation. And right now we have to change gear. We've heard so much about this, menopause, erectile dysfunction. This is not a death trap. So there is hope. So my presentation this morning, of course, evening for you in Nigeria, is just going to give you hope. So first of all, let's diagnose. How do we know that someone is going through menopause? By just getting some information about the patient, history taking, just talking to your provider, talking to your doctor will definitely tell your doctor that you're going through something, you're going through menopause. So change in menstrual period, your hot flashes, the vaginal dryness, So these alone will tell us that you are in your menopausal period or perimenopausal, or of course premenopausal period. So like we have already talked about, that period whereby you're transitioning from your menstrual, your productive period from menarche to this period around 45 to 50, just telling us something about that, everything going on with the irregular menstruation coming, you have menstrual, you have your period this month, then after 3 months, you haven't seen it again. Maybe it comes again, then in 6 months, it stops, but not until the 12 months, as we have already said it here. You're still, trying to transition from here to menopause. Then blood work. So the tests that we done to check your hormones for every woman during your productive period, your ovaries, the 2 ovaries that we have produce these hormones responsible for keeping your menstrual period going, your regular periods. But at this time of menopause, the follicle stimulating hormone, the FSH, as popularly known, the LH, these are the hormones that are released from the brain. So remember, we already talked about how the center in the brain is responsible for this whole process. So we test to see how much of these hormones you have. So because the ovaries are shrinking already, they're no longer as productive, they're no longer producing enough of these hormones to keep you going, to keep your menstrual periods. So estradiol is one of them, the estrogen, derivative of estrogen. Then, of course, the progesterone, the testosterone, as we already heard. These are the hormones that we check. We make, to see what level you have these. And there are other advanced testing that we don't even need. By the time we do the lab test, we can diagnose, okay, this is what's going on. Note, hot flashes as a result of menopause can be a very serious physical burden. And this is stated by this researcher with working with FDA. Then again, be careful about medicine purchased from unapproved. These are all caveats. I just want you to know, purchased from unapproved or unlicensed sources. These medicines may be dangerous for you. So this is a period you want to stay in touch with your provider and constantly talk about these medications. A lot of doctors out there, Google doctors, they will tell you so many things, but just be very careful. Next slide. So for conventional treatment, of course, treatment widely accepted or widely used by doctors and providers, HRT. When you hear hormone replacement during menopause, a lot of people are not very open to this, but there are specialists who are specialized, who safely treat patients who deal with menopausal symptoms. And this hormone replacement therapy can be very, very helpful. The estrogen, then there is also combination pill, the estrogen and progesterone. But in order to use this particular treatment, there is a very comprehensive, detailed examination, and which is why so many doctors do not prescribe these medicines, but these are lifesavers. They're miracle worker. So you want to make sure, you want to stay in touch with your provider who will evaluate your family health history, your health history, evaluate so many things, your lifestyle, your comorbidities, other medical problems going on with you. So all these things have to be factored in order for you to be on these medications. So for vaginal dryness, there are so many agents out there. But for these agents, like the lubricant, they have so many brands at the pharmacy store. Some of them are for with the hormones. And like I said, that concept of making sure that you are a good candidate for these medications applies to the use of these. Then there are the ones, the herbs. They come in tablet, they come in patches or vaginal rings. There are different treatments, which a lot of people don't know about because, you know, people are not very open to it. Then the hot flashes, the symptoms that we have already been talking about here. Of course, there are the non-hormonal ones. We have mentioned earlier in the presentation, the antidepressants. But for the most part, the lifestyle changes, your diet. Then minoxidil, which is usually used for hair loss. These are given by the dermatologist. And like I said, there are specialists who are very good at treating these problems. But remember, menopause is not an illness. This is a normal transitional, a transition from one stage of your life as a woman to the other. So you're going from productive life to non-productive. When we talk about that, when you can no longer it's not possible to be pregnant. So just be yourself. It's a normal process. It's a physiological change. It's just like for gray hair, you cannot avoid it, but some people develop gray hair at a certain age, and some people will develop maybe later in age. So that's the exact same concept with menopause and the erectile dysfunction for people who have it. Then exercising, walking, swimming, hiking. For the most things I do recommend to my patients is you don't have to go outside to do these things. You can just turn on your favorite YouTube music and dance with the kids in the house. So these are some of the things you can do to occupy your mind. There's so much to do with mind and body when you talk about menopause and erectile dysfunction. Engage yourself with something that will keep you busy and you will not think about the body heat. Then your relationships with the children, of course, your friends. I tell people no man is an island. You need your good friends. Talk to your friends, share some of these things. Food is the main one. Food, do you know about our ginger, our garlic, a lot of water, tofu, soy milk. Then when we talk about herbs, something like estrogen is very popular. And estrogen, it sounds like hormone. It's not. It's very popular. But I know so many people, so many women will want to do it on their own using lifestyle, which is good. So once you feel these symptoms, all those things that work for you, especially drinking cold water, leaving the AC on or leaving the fan on for people who have light. I'm not talking about NEPA issues. So leave the AC on. Then just take care of yourself. We have in the whole food store, we have the black cohosh, the red clover extract, the ginseng, the St. John's wort. These things are in the food store. Then the mind and body practices having to do with your mind, your mental. So just resting, sleeping well, find those things that make you sleep better at night, because these things, menopause has so much to do with stress. You're very stressed, you didn't get enough sleep. So find out about doing your green juice, maybe at night, the ginger, the garlic, make these, blend them, drink them, see when it works better for you. But for us here in the US, there is this big medication approved by FDA, the Veoza. Patients have seen this as a miracle worker, as a big lifesaver. Veoza is usually taken, is being prescribed. Yes, it was approved not too long ago, but it works. But I know our lifestyle changes, our vitamins, fruits, vegetables, do your meditation, relaxation techniques, rest and sleep. And for people who can get sex, you get your sex, then yes, then women often spend most of their lifetime after menopause. However, this is a time to constantly be talk to your doctor. Talk to your doctor. Your provider is your friend, is your partner. You can send text message and let them know, what do I do? Man, this is getting over me. You know, what can I do? I've done this, I've done that. So make sure you are talking to your provider. Be sure to learn about how to protect your heart and prevent bone loss as you get older. We know about bone loss during menopause. This is when the bones are not as strong as as it were in your youthful age. At this time, this is when you want to protect yourself. Drinking a lot of water, fruits, vegetables. Always tell your provider that there is vaginal bleeding. So this is something that we do not take lightly. Whenever a woman reports vaginal bleeding during menopause, we investigate further. So this is why you should constantly talk to your provider in order to make sure that you get the care that you need. So for testosterone, which is part of a female hormone, is male hormone, but for the females, there is small part that is also a small portion of testosterone that is also produced by the ovaries. It's usually male hormone, small amounts from the ovaries and the adrenal glands. You can see some women who have more acne than other. It could be associated with high testosterone level. It's supposed to be in small level in a woman, but there are women who make a lot of testosterone. They have excessive body and facial hair. There could be hair loss in their head. There could be, you can hear some people when they speak, some women, they speak, they sound like men. Irregular periods, infertility, and they pray PCOS, that could also be the problem, maybe associated with high testosterone level. So this is just the reference. You can go on these websites and get a lot of information. All we are doing is giving you tips and empowering you in order for you to go back to these sources and get more information. And at this time, I would like to introduce our Dr. Obinna Oleribe. He is well versed in public health. You can see all the qualifications. This man right here will take it up now and talk to us about erectile dysfunction management. Take it over, Dr. Oleribe. Thank you all.
Wow. This has been a very, very full day. Thank you, Dr. Peace Ume, for that excellent presentation, and also Dr. Angela and Dr. Uche for the earlier presentations. I'm sure that all the 54 people who are here today are having a very informative season looking at erectile dysfunction and menopause. And when such amazing ladies speak before you, you lose your voice. You don't know what to say again. But let me see if I can just share one or two slides on male erectile dysfunction. As you heard Dr. Angela talk to us about it, she said that over 50% of men have these problems, over 150 million people already, and by 2030, over 320 million people will have the problem. Unlike menopause, which is part of aging, ED may not be part of aging, although it's commoner as you get older. That's why it's important for us to look at how can we manage, prevent, and or control erectile dysfunction. So, Dr. Angela gave us so many causes of erectile dysfunction: physical causes, drug causes, radiotherapy, chemotherapy, and other factors. But it's important to understand that only about 10 to 25% of erectile dysfunctions have physical problems. Studies have shown that 75 to 90% of cases are actually either mental or emotional in nature. That means those ones she mentioned later, issue of depression, anxiety, stress, relationship issues, burdens on your mind, are the fundamental causes of ED among men. Because studies have shown that many men that have ED do not have diabetes, hypertension, or cardiac problems, or thyroid issues, or whatever she has mentioned earlier today. Although those things can cause ED, they are not the commonest cause of ED in our generation. That's why recently I had a friend of mine who had ED that came to me and asked questions about what do I do? I said, okay, go and do some lab tests. Let's rule out all the issues that Dr. Angela mentioned earlier on. So the diabetes was normal. One IC was just 4.6, which is at the lower level of diabetics. Thyroid was very good at 0.93. Sodium and potassium were very good at 140 and 48, 44.6. He also did a PSA for prostate, which was actually at 1.1. You need to have a less than 3.5, which was also very good. Liver was very good with creatinine, ALT. I've been asking to do stool tests to find out whether he has cancer or dystechium. It was negative. So all the tests that he did were negative. Okay, so it could be testosterone that is the problem. I asked him to do that. So he did that. And surprisingly, the result came out showing that he has 1,000 plus, which is actually above the normal. So it wasn't a physical problem. We were still looking for the cause. So we went on to do more investigations, cholesterol, triglycerides, DHL, and all the blood works, they were all normal. The only one that was slightly raised was the low density lipoprotein, which was above 99 milligram per DL. This cannot be the reason why he was having erectile dysfunction. That means it was not a physical problem. It's more like either mental or emotional. And you understand and agree with me that most men are under serious stress. Work stress, financial stress, paying of bills, trying to meet the demands of the society, trying to satisfy their boss at home, satisfy children at home, at work, at home, in church, in the city, attending meetings everywhere. And this could actually be the primary reason why most men have issues. So to address it, therefore, we must address the primary cause, which is stress and emotional problem. But let me start with drugs, which we all know about, and food. You have to try aphrodisiacs. They are there in the market. They are there with your care providers. But as Dr. Peace mentioned, food, herbs, aromatherapy, and drinks can actually help you to an extent. The same thing that will help a woman who has menopause will also help men. That's why you don't need to cook different pots of food. Both of you can drink the same drinks, take the same food, enjoy the same oysters, chocolate, strawberries, and watermelon, coffee, and all that stuff to enhance your capacity to perform. But if you meet your providers, they may give you aphrodisiacs like Viagra or Cialis or other drugs, which are here already, and they have their benefits and side effects. Please understand that these drugs have side effects, and they are only relevant for those who have been screened, who do not have all the conditions that Dr. Angela mentioned. You don't have a heart problem, you don't have a high blood pressure, you don't have diabetes, you don't have cholesterol issues, because if you take this drug without proper screening and evaluation, you may end up fast-tracking your demise or stroke or other challenges that may come from them. But once you've been screened and it is found that it's not a physical problem, then Viagra works very fast. It can work within the first 5-10 minutes. Tadalafil will work about 30 minutes after you take it. So you just know what you need and how to use it. And please, if you get these drugs, use them according to the prescribed doses. Don't overdose yourself. Some you don't need to take more than one a day or once in a week or thereabout. Find out what the ideal dosage is, and please stick to it for your own good and for your own well-being. Understand this, young man, that you have to live to be of relevance to anybody. So don't go out there to kill yourself because you have an issue that most men, over 50% of men, may have. So, and when you see some men on videos and films doing some amazing stuff, you get jealous and you start feeling so bad about it. Understand that some men may be on different kinds of medication and treatments. There's a vacuum erection device that people use, which is actually invasive. You use a vacuum to create an erection. Some use intracavernosal injections, which also is a combination with other agents that can help to have an erection. Some actually have an intrauterine prostaglandin pellets, which also helps them to stay up and do their work. And many may even have penile prosthesis implantation during surgery. Again, these are successful, but they are invasive techniques that can help somebody having erectile dysfunction to have a normal sex. But then you're doing it because you feel, like Angela and Dr. Uche said, you feel you've lost yourself, you're no longer a man, you can't do what other men are doing. And so you expose yourself to these surgeries. They can work, and sometimes they have their side effects. So before you take any drastic step, review yourself first. Find out, do I have a psychological, emotional issue that need to be taken care of? And if you can just resolve that, you'll be surprised that you'll be as strong and as capable as any young person around you. So that's why you need psychological and management of your ED. Counseling and psychotherapy are very critical because this will help you to reduce the psychological issues around your ED. And also lifestyle changes, like Dr. Peace mentioned, the kind of food you eat, exercising regularly. So she said dancing in your room, which is also very interesting. Dancing, swimming, walking, amazing things you can do on your own without having to spend any single dime of your resources. Then if you are fat, lose weight. And if you're under stress, I would say reduce stress. I know it's difficult to do that, but that is what every health worker will tell you, reduce stress. But if you have not paid your house rent, if your car is having an issue, if your kids are not going to school, if you have a number of other issues around you, any reasonable man will be under stress. But friends, your stress is not helping. It's making it worse. So do all you can to minimize your stress. So have emotional stability at home and at work. That's very important. That's why also I like what all the doctors have said this morning. Dr. Pete, Dr. Angela, Dr. Uche have talked about the support of the family. Your spouse needs to be part of this business. They need to find a way not to add to your problem, because most men have very strong families causing additional headache and additional problem to a man who is already under stress, having difficulty being a man. So no shaming, no name calling. What we can do is to increase the romance in the house with more stimulation. Like Dr. Uche said, they may need more stimulation, more romance, more activities. Just like every person needs to be supported to succeed in this area at this point in time. And since we are all monogamous families, we have our wives and our husbands, there's a need for husband and wife to come together and find what works for them and make it happen. It's not an issue of blaming the man or blaming the woman. It's a responsibility of both if they want to continue enjoying their sexual life even at this point in time. And I've seen families that have enjoyed their sexual life up to the 80s and 90s and 100s. So it's a function of husband and wife understanding that change occurs. As you get older, change occurs. And this change could be genetic, could be biological, could be emotional, could be physical. And whatever it is, together, it can be handled and dealt with. But when there's a pointing of finger on somebody as the cause of the issues, then it remains and remains for a very long time. So, final words, friends. Men have a lot of headaches. I'm a man, so I'm talking like a man. I'm a man, and I'm in my 50s, late 50s actually right now. So men have a lot of headaches. Do not add to our headaches. If you are our spouses, if you are our children, if you are our friends, help us to resolve the headaches. Rather, heal the monotony in marital relationships. Bring in excitement, ignite the romance fire, and make good things happen. And it can happen if both parties work together to make it happen. Thank you very much. Now it's time for our questions and answers, and I'll bring back Dr. Angela to moderate this section. Thank you for listening.
Lots of information and lots of great questions in the chat section. Think we can go and start from there, because a lot of those questions are things that most of us would benefit from. So let's go back to the chat. Except if anybody has a question, they can go while I pull up the chat questions. You can raise your hand and we'll identify you. You have been such a great group of participants. Thank you for attending. Okay, so I have a question here on using hormone therapy to treat menopause, symptoms of menopause. So I'm going to direct that to Dr. Peace to throw more light. I know you did mention something about your healthcare provider being involved, but go ahead, Dr. Peace. Can you throw more light to that question, please?
Thank you so much. And thank you, Dr. Lillian. That question, I saw that from you. Hormone replacement therapy, as I said during my presentation, could save women's life, women who go through hot flashes associated with menopause or other symptoms like osteoporosis and or even vaginal dryness or pain during sexual intercourse. So these things are what make menopausal experience very overwhelming. So if you remember during my presentation, we need to be in touch with our doctors, our healthcare provider, who will look into your health, look into your overall health. What are other medical problems that you are dealing with? Is there any family history of cancer? Have you in your lifetime had vaginal bleeding, or maybe you are a cancer survivor? These are some of the things that have to be evaluated before you are placed on hormonal therapy. And we have the single treatment, the estrogen. Estrogen or estradiol, some of the medications, they come as estradiol, a derivative of estrogen. So these will protect you from having these symptoms. They help you, for the most part. It helps to even keep your bones intact. It maintains your bone density to protect you from getting fracture when you fall. So this is why during menopause, this is when we want to be very careful. We want to engage in lifestyle to keep the bones healthy. So for the specialists who are very comfortable, very confident treating patients who deal with menopause, they give hormone therapy. So for the, and these do not come without side effect. So your liver function will be perfect. Your kidney function is perfect. You don't have these comorbid conditions. You don't have any chances of developing cancer because the third cousin had uterine cancer or had breast cancer or cervical cancer. So it's a lot of health evaluation that takes place in order for you to be on this medicine. So, but to be honest with you, they are very helpful to protect women from dealing with this. So there's a lot of blood work that has to be done. From doing the testing, we'll be able to know that, oh, you are a good candidate. Yes, hormone therapy is good, but it's not for everybody. It's not for everybody. So you have to go, you have to go through this extensive healthcare evaluation in order for you to be to use this. One more thing, I have this patient. She comes in, she tells me how HRT, hormone replacement therapy, has been a miracle worker for her. Like, she's in her 70s. However, we want to limit hormone replacement therapy by age 65, 70. We don't want to continue that. But some patients found it very helpful that they don't want to stop taking this medicine. So I'm not sure if I answered the question, but yes, it's good, but it's not for everybody.
Thank you, Dr. Peace. You did, and I'm continuing to learn more and more, even as a presenter, from that response. Okay, we have a participant's hands up. Mrs. Elegance Hippolyte Eleganza, you can unmute yourself and go ahead and ask your question, please.
Okay. Oops, hang on. Oh my God, my camera is not coming up. I don't know why. But thank you everybody, all the panelists, for such an amazing presentation this morning. So I just want to kind of piggyback to what you all said. And for all the wives and husbands, I don't know how many men we have in our midst today. I just want to touch on something that is not pharmacological, where a couple can actually help themselves. They said a couple, a family that prays together stays together. So if you know that there is a deficiency on your husband's performance, before you even start the act, both of you should get together and pray that, maybe, whenever you're having this, let God help you both. Psychologically, it helps both parties to relax. Spiritually, so this is just knowing them calling, this 1 minute man and other stuff plays, I don't think is healthy for relationships and also for the man psychologically. So that's just the little thing I want to add. Thank you everybody for your wonderful presentation. It's very, very informative.
Thank you. We appreciate your contribution. Thank you. Thank you. There is a question on, I guess, a concerned spouse asking how can we prevent pot belly in a better way to say, but I'm thinking, pot belly happens both male and female, but how can we work on, that part of the body that, is impacted during menopause for sure. I don't know for men, the contributing factors for the belly fat, we call it. How can we help that? Dr. Leribe or any of the presenters? Can you chime in, please?
Thank you, Dr. Angela. I think it's not easy. It's actually better prevented than cured, because in public care, we say prevention is always better than cure. I remember some few months ago, my daughter was telling me that my stomach is getting so big. And so I had to start doing something about it, deliberately, to reduce the size of my stomach. And right now it has significantly gone down. But it requires your commitment for change. And there are 3 or 4 things that everybody can do to minimize pot belly. One is to limit the number of times you eat very late at night. If you can avoid eating after 6 p.m., that would be great. That way you're able to digest most of the food before you go to sleep. Number 2 is exercise, which is critical. Take a walk, do sit-ups, do things you can to just minimize, to burn the fat. The goal is to burn more fat than you eat on daily basis. Because when you do that, that way you'll be able to minimize adding weight generally and in your stomach. And stomach weight gain comes again from alcohol consumption. People that drink alcohol a lot end up having very big pot bellies. So if you can minimize your alcohol intake, if you can do relevant exercises, if you can actually eat before 7 p.m. every night, if you can do that, or do eat after 7 rarely and something very light, you'll be able to manage the issue of pot belly. But there are also surgical procedures for that, but that I will not recommend for anybody, because it also has its own complications. So lifestyle changes can go a long way. And if you smoke, stop smoking. Smoking also contributes to pot belly. So smoking, alcohol, exercise, dietary controls can go a long way. But friends, it's not a sprint. If you already have pot belly, it's not a 1 month it will disappear. It can never disappear in 1 month. So you have to have the continuity of practices for several months to begin to see some good results in your stomach reduction. That's what someone can ask something extra. Thank you.
Thank you. Am I missing any questions? On a lighter note, somebody did make a comment that a 71-year-old female got pregnant at 71. So can we chime into that? I'm thinking asking myself a few questions. Is it an egg donor situation? Is it implanting situation? Is what are the other factors that we are not aware of, other than that we saw a 71 years old woman that is pregnant, is pregnant. So there may be other things going on here, not just simply getting pregnant the natural way.
Yeah.
So that's my thought on that. So
you're very correct, Dr. Angela. It could be we don't know the whole story. We don't know the whole story. So it could be an egg donor, it could be an IVF, it could be anything. But I also said to that comment that it could be a miracle.
It could be a miracle.
I believe in miracles, actually. So the woman can get pregnant at 70 by a miracle, but it is not a natural common occurrence. There are people who are completely outside the normal curve, who are the extremes of the normal curve. So I've seen people who can begin their menopause at 25 and those who can begin at 65. So individuals may vary at what time they start their menopause, but these are outliers in the system, and that could happen. And as somebody asked a question, do I understand you recommend Viagra and drugs when there's no physical cause for ED? Yes, but you need to talk to your doctor and ensure that you have screened out all the conditions that could lead to ED. And when you have screened out all the medical conditions and your heart is strong, your system is strong, then your doctor can recommend Viagra and other aphrodisiacs for you at a reasonable dose.
Okay. Thank you. I want to share something with us, especially a cultural thing. We as Nigerians, we grew up shying away from anything. We're not raised by our parents to be very sexual. And a lot of times we expect a lot from ourselves, thinking that there's only one way you can, you and your partner can pleasure yourselves. This is PG. I had a patient one time. These are a husband and wife admitted to a unit, a psychiatric unit that I worked at. These are husband and wife. They're like in their 70s. Both of them were already developing dementia, kind of dementia, but not, the husband I think had Alzheimer's already, but the wife was already developing memory problems. It can be classified as dementia. And these two people were placed in one room. These are men, these are a husband and wife in their 70s, but they still found time to get themselves to that happy place. Not by the natural way. There are other ways. So when we put those expectations on ourselves, it's a lot of pressure as well on the family, on the spouse, and it brings discord, a lot of, hurt feelings and all that. If it doesn't work this way, it can work the other way. So maybe, we need to explore that as well, because men are not going to have erection until 100 years old. Women will probably, with menopause, dryness, and all that stuff, things will happen, and libido and all that stuff. So, as with your spouse, with your husband, with your wife, let's figure out other ways to keep our family together when it has to do with sexual activity. That's one contribution I wanted to make. Thank you.
That's very good, because actually I mentioned in my presentation on the need for varieties and trying new stuff. So as we get older, what worked when we were younger may not work at this age. And so we should be open to new things and new ways of self-satisfaction and family satisfaction. Somebody asked a question on masturbation, asking, does masturbation lead to ED? The studies are not conclusive. The studies are not conclusive, because sometimes people masturbate because they already have ED, and sometimes they masturbate before they have ED. So there are no causal relationship between masturbation and ED, but if it has its own psychological impact on the individuals, and this psychological impact may be negative if not properly handled. So are you asking me whether I should encourage masturbation? I would say no, because medically speaking, it's not very healthy, but people have different views about masturbation. Thank you.
Thank you. I have a hand up.
1 second.
Sorry. Somebody speak? Are you contributing to that response?
Yes.
Go ahead. Go ahead.
So actually, masturbation should be for someone dealing with ED, masturbation should be a way out, should be beneficial. So it helps to manage ED. So with masturbation, one thing is that it sends out, it's sending out some message to the brain, because these problems have to do with your brain as well. So it stimulates the brain to, to help to correct erectile dysfunction. So masturbation is a good thing, if I may say. But you know that too much of everything is always bad. That's concept that we all know about. But masturbation is a good thing when it comes to erectile dysfunction. So it does not cause erectile dysfunction. Rather, it helps erectile dysfunction. Thank you.
Thank you. Let's go to Mr. Ngaume. Unmute yourself, please. It looks like you're still muted.
Oh,
There you go.
can you hear me now?
Yes, yes.
Oh, thank you to all the panelists and the cfhi, for this presentation. And I am really delighted to hear all of you that you're not only speaking from, the research and, your educational background, but also the cultural acculturation of, your presentation, adapting it, to our experience as people of a culture. And I love, what Dr. Angela, mentioned about, finding alternatives. And in my experience here that I wanted to contribute is that there are other resources when men and women find themselves, in this, stage of life. It is a stage of life. And, I believe that longevity is a blessing. And when we get to the point, of experiencing, ED, menopause, that as the presentation said, it's not an illness, but it is, a stage, in life. And there are resources out there for encounters, for couples who are in this stage, of life. So I just wanted, to throw, that out in addition to the spiritual, aspect and advice that was given, that we also, as, in our culture, in our community, to look at, other resources for couple encounters, that will give you ways, to get to that, zone and place of, enjoyment, in later years, in life as married, couples or, adults, in adult relationship. Thank you.
Thank you so much. Any other questions? Let me see any other comments. Let me see. I don't see any other questions on here that we have not addressed. So,
Sorry, can I say something about use of Viagra and other similar medications? We know that most men, because they listen to others, they talk to the Google doctors about these medications. They even have ways of getting them without even contacting their doctor. It is not a good practice to use these medications on your own, because as much as they are very effective in helping with erectile dysfunction, they have a lot of side effects. They are actually dangerous. Some of these medications, even Cialis, Viagra, and other ones, they could give you erection that is nonstop. And in that case, you are exposing yourself to the risk of cutting off circulation to your penis or the organs around the penis. So constantly be, talking to your doctor, making sure that is a safe medication for you. Yes, they work, Yes, they can cause complications that are irreversible. They cause death also. So I'm not trying to throw fear here. There is hope, like I said. There's hope for us, for anyone going through these life changes, these physiological changes. So make sure you taking these medications that you are being safe to your health. But again, lifestyle, very important. Lifestyle. Thank you.
Thank you. Thank you, Dr. Peace. Yes. Preventive measures, prevention is better than cure. Whoever invented that statement from many years ago must be one of the smartest people ever. All righty. So we did this presentation or this particular session in collaboration with Imo State Women Organization of Southern California. I welcome all the members again. And I think the president was here prior. I don't know if she's still here. Did you want to say anything, Dr. Lillian Ndukwe?
Yes, I'm still
Go
here.
ahead. Okay, go ahead. Thank you.
All right. Good morning, everyone, and thank you for working. It's not easy to be a teacher, and you guys did a wonderful work this morning. Explaining to us, and this is something that we need in our community. And I also want to thank you guys on behalf of Imo State Women Organization for partnering with us in order for us to be able to achieve our goal also. So we are happy, and I'm happy that our members are here in full pledge. And I really want to thank you guys. You did well. And some of the questions that I throw there is because I want to know more about it, because that's why we're here. And every one of us know how important it is. Like I said in our forum in Imo State, I said, if you're not there yet in menopause, you're heading there. It's a course that everybody will have to go through. Whether yours is serious or yours is mild, you still have to go through it. So on behalf of Imo State women, I say thank you guys, and more grace and more strength as you continue with this community awareness. And I also want to use this opportunity to also thank our welfare committee for helping us to make sure that we connect with this team in order to get this done. Thank you. We appreciate you.
Thank you so much, Madam President. Talking about the Wellness Program Committee, the chair is as well here. Lolonga Zume, thank you for collaborating with us or being the connection to Imo State women. Enjoyed all the conversations we had to get here. Thank you as well. Okay. Ngo, Mr. Ngo Noram.
Yes. Real quick.
Okay, go ahead.
Real quick. First, I want to say thank you to all the doctors and doctors, my friends, except Dr. Loribe. Thank you, Dr. Loribe. But I have a question. Right now, since I entered menopause, I've not had any symptoms, which I'm so grateful to God. Is there a time in my life when I'll revert to that, having something? That has been bothering me, I'm like, God, I hope it stays this way,
Yeah.
Wow.
So one of the lucky ones.
Yes.
Mm-hmm.
Not even hot flashes, nothing.
Wow.
Oh, I'm so grateful, but I hope I don't go back to,
No,
so
you won't.
what do you doctors, what have you experienced with your patients?
I can share my view on that.
Thank you.
Go ahead, Dr. Peace, go ahead.
Thank you. Family history, genetics. From the introduction we all listened to, you can see the genetic component of these physiological changes of individuals. So with you not having to deal with this, my goodness, you're one of the lucky ones. Yes, some, some families
Wow.
done some hereditary, so hereditary as a concept comes in. Not, I remember when I first started experience of menopausal symptoms, I remember what my mom said. My mom was like, oh, this thing started, you started too early. So, but again, it depends on number one, individuals, and of course, your hereditary background, your genetic makeup. So just thank God that you don't go through this, because patients will come in and they will tell you already that I know hormone replacement therapy is not it's not the safe thing to do. And please put me on hormones. I do not care if I have cancer. Patients say this. I am so sorry. I have to mute everybody. Sorry. Yes. So patients tell you, I want hormones. Give me hormones, because these are very distressing. Menopausal symptoms are not funny. Like, you go through so much, and it might be severe on one person. It might be, some people see, they experience it differently. So you are lucky not to have it. Please don't even get there. So one thing is that there is age range, but again, you never know what could happen. But there's no high chances of you having menopausal symptoms after after 60 years of age. Okay, so that's one thing. And somebody said something here. So usually within that time frame, that window of 45, 55, so there's no likelihood that you have those symptoms if after 60 years of age. And again, when you have things like that, be in touch with your doctor, when you develop menopausal symptoms after this certain age in life, of course you have to go and get checked for other things. Yes. Thank you.
Thank you, Dr. Peace. Our goal is to end this discussion. But
Thank you.
Was to end this presentation by 11:30, but I see one more hand up. I don't know what we can learn from that person. So she'll be our last speaker. Yes.
Dr. Angie, can I say a word before you continue towards answering?
Please make it very brief.
Very brief.
11:30. Yes.
I will. Thank you, my sister Ngozi Naram, for that question. Part of the reason why we talk about stress at all times. Stress does a lot of things. It can bring out illnesses that we don't even know that we have. When you come from a happy home, when you make time to reduce the stress that your challenges, there are stressful events that are stress is a killer. So it is important that we make every effort in our power to create a happy home for us. Make our time to take care of yourself, and some of these symptoms you may never have because you are taking care of yourself in one way or the other. That's all I have to say.
Thank you, Dr. Uche. And I see Dr. Ndachi's hand is down. Thank you very much, everybody, for coming. And to close out, I'll tell you that my grandmother had so much Okirimbawishi headache, migraine headache, and internal heat. My mom, when she was visiting here, she almost went to the psychiatric evaluation because she could not believe what was going on in her body. That's the genetic component of it. So, when I approached menopause myself, I handled it better because we are more educated and exposed, and we have anticipatory guidance. So that's why these sessions are very good. If you're not menopausal yet, you know what to expect. And if you know what to expect, you're better apt to handle that situation much better than our parents did. So thank you, everybody, for coming. Dachi, you still have your hand up because I'm closing. Can you unmute yourself? Okay. So thank you.
I just want to make it very quick. Ngo, you're very lucky. Thank your God. I went crazy. Even dryness in my you-know-where. I got it all. And mine started like before I turned 50, honestly.
Yes.
And it just stopped like a few years ago. Lucky
Yes.
you, my dear.
Yes, yes. And I'm
Though
sure
the
your
Viagra one doesn't concern me. So
your mother
Oh, I
probably
thank God. I thank God.
All righty. Thank you, everybody, for coming. Please be on the
Thank you.
lookout.
Thank you, ladies.
Our next
Thank you. I
presentation.
enjoyed it.
Health is
Thank you.
wealth.
I
Yes.
enjoyed this. Thank you. Thank you so
Health
much.
is
God bless
Thank
you,
you.
ladies,
And we'll share
for
the
bringing this
YouTube.
to our community.
We'll share the YouTube link for you to go and look at it and share with friends who were not able to come, and for you to also revert back to refresh your memory. Thank you, everybody, and have a good rest of your day.
God bless you.
Thank
Bye.
you, all your
Bye-bye.
presenters.
Bye.
Wise.
Thank you.
That's a very good education this morning.
Thank you. Thank you for coming, joining.
Thank you.
Thank you. Thank you, everybody.
Thank you.
Enjoy
Thank you.
yourselves today. No stress.
Yes, because mmiri ṅụọ mmiri ọfụma.
Yes. Stay hydrated. Go and dance at the parties. Have fun.
Okay, so Angela, stop recording, please.
Oh, peace.
Let
Dr.
me
Peace, go
stop.
ahead.
Sorry. I forgot. Yes, stop
Okay.
recording.
Thank you. Dr. Peace, you want to end this?